Many people are aware that when a child is easily distracted, has difficulty paying attention, has trouble sitting still, and acts like, well, he's driven like a motor, it could be ADHD. But what is ADHD exactly? Because couldn't those struggles be age appropriate? Some have asked me, doesn't everyone have trouble paying attention sometimes? Well, today my guest is going to provide the answers. Today we are talking about ADHD. Attention Deficit Hyperactivity Disorder, what it is, what it's not, and discussing common misconceptions. My guest today is Dr. Nicholas Thaler, a board-certified clinical neuropsychologist with extensive experience working with individuals across the lifespan. He specializes in assessing youth with learning disabilities, ADHD, and traumatic brain injury, and he's published over 50 peer-reviewed papers about neuropsychological conditions. He maintains a faculty position at UCLA and is the current president of the Asian Neuropsychological Association. Let's get started.
Millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Hello, Dr. Thaler. Welcome to the Diverse Thinking, Different Learning podcast.
Thank you so much, Dr. Wilson. Delighted to be here.
I'm so thrilled that you are here. I know we are colleagues and we've interacted a great deal in the work that we do. And, you know, I think I spoke to you before about the fact that we've been talking about a lot of different topics that parents want more information about, educators want more information about. We've discussed dyslexia on the podcast, and there are a lot of questions about attention and hyperactivity and problems with executive functioning and ADHD. And I said, I want to have this discussion about ADHD and maybe just start with an introduction to what it is, because even in this day and age where there's been so much research and there's so much information and it's accessible, people still have a lot of misconceptions about what ADHD is. And I think even now, wouldn't you say that during the pandemic over the past year, more parents have been kind of looking at some of these behaviors at home and wondering, did my child have ADHD and I just didn't know? Or, you know, is this a reaction to, you know, just prolonged distance learning and screen time? So I think it's an interesting question. Has that come up for you in your practice?
It definitely has. I've gotten quite a few calls from parents who I think perhaps due to the pandemic are finally spending a significant amount of time watching their child in a learning environment. And there's a lot of questions that emerge in such a situation. They're unsure if their child is having difficulty focusing because of the learning style, or is it the teachers, or is it something that's neurodevelopmental? Is it emotional? So these are some of the common questions that are posed to me from parents.
Right. And sometimes it's hard to tease that apart. And that's why people like you are so important, because you can help families really dig in there and determine, you know, is this an ADHD? Is this a result of lack of sleep, sleep deprivation? We've talked about that a lot on the podcast. Or is this related to the mode of instruction that the child's just not engaged? And oftentimes parents don't know, and educators don't know, particularly if kids have their videos off, their screens off, and they don't know if kids are paying attention. So it's really hard to tell. But, you know, a lot of kids are going back to school and they're back in the classroom, and some teachers are seeing these students for the first time and maybe noticing, you know, that maybe there are some attention struggles, and is this normal kind of kindergarten level attention struggles? Is this normal, what you would expect for a boy in the 4th grade? And I think that's the question, is that parents don't know, well, is this normal kind of behavior for a child my son's age or my daughter's age, or is this something that I should be concerned about? And so I'd love to jump in and kind of talk about maybe first when parents should be concerned, and then talk about kind of what ADHD is. And then we'll kind of go from there. What do you think?
Okay, that sounds fine.
Yeah. So like, I guess the first part is like, when should parents be concerned?
Well, it really, I think to start with what ADHD is, attention deficit hyperactivity disorder, it's a behavioral and cognitive disorder, which is linked to struggles in the executive functioning system, which can result in difficulties with self-control, with sustained focus, mental organization, and working memory. And because it is kind of like the quintessential executive condition that we often assess for and diagnose in neuropsychological evaluations, it can mimic a lot of other conditions that also affect the frontal executive system. And I like to call it frontal executive. I know some people call it executive functioning, but to me, it's just tapping into how so much of this is due to just whether it's due to something that's idiopathic or environmental. There's a delay in the maturation of the frontal lobes that is developmentally considered to be inappropriate for a child in their current learning environment. And I think, in terms of when parents should begin to express concerns about ADHD, since so much of what ADHD does is impact behavior, it impacts social emotional functioning, it impacts learning. We wanted to see some sort of impact in a child's current learning environment in order for us to, I think, come up with an appropriate response to how to address it. This is to say that, for example, a 4-year-old who goes to a Montessori preschool, who's running around with his friends, that's probably not the time I would immediately think, okay, we need to have a child evaluated, even if they are a little bit, speedy or bumping into other kids, especially because at the ages of 3, 4, 5, there's so much neural development that's occurring. There's so much maturation of the executive lobes that you can find a child who at 3 may present like a child who's unusually hyperactive or disruptive. And by 6 or 7, a lot of that just kind of matures. They kind of outgrow it. Now, I think when a child enters a school system, and, I think of like a more traditional classroom environment, public school system, for example, this is where some issues of concern might emerge. I think that there is, in cases where ADHD is quite significant, going to be some questions raised by teachers as early as kindergarten, even first grade, for children who have milder variants of it. And Karen, I definitely want to speak about the inattentive subtype and intersect with gender and ADHD. I find that age 8 or 9 is often a good time to consider a referral for an evaluation, because then you're going to have some consistency. You're going to have, the children who are going to naturally outgrow some of the more profound dysexecutive behaviors just because they're little kids will start to, you'll start to see some measurable changes by 8 or 9. So those who continue to have additional difficulties will start to stand out a little bit more. It's also, I think there's a switch around 8 or 9, and maybe this has been discussed in prior podcasts about how learning is really going to shift from technical acquisition of skills, so phonics, basic mathematics, basic arithmetic, learning how to read. And now it's more about reading how to learn, more about applied academics, self-directed assignments, taking homework home and doing it presumably on your own. And this is where the executive system is taxed a little more heavily. So again, that's seen usually, depending on the school, around 3rd or 4th grade. And that just increases incrementally. Then I think another time where there's a consideration is when there's a major change in environment. So a child who, for example, goes to a middle school with new teachers, new peers, new stressors, and there maybe the executive system is finally kind of hitting its limit, and you're going to see some difficulty. So I find children who are transitioning to middle school who are bright, who are verbally especially above average, who have ADHD are sometimes not detected until that time of their life. There's always going to be opportunities to have a child assessed. But to me, I think some of these big transitional points, so again, the age 7, 8, and then changes to a new school or a new type of school, are times where there may be a need to evaluate and maybe, determine whether it is ADHD or if there is a sufficient alternative explanation for the changes or difficulties that the child seems to be exhibiting.
Right. And those are some great points, particularly about the maturation of the brain. And you want to make sure that what you're looking at isn't developmentally appropriate, which is why you kind of observe. And then there's a point where, if a child is having difficulty accessing their curriculum or it's interfering, at age 8 or 9, when those demands, like you said, are increasing, then it might be time to take a look and determine whether or not this is an ADHD. And, one of the things and you talked about this, you mentioned inattention. And I think, some of the confusion about ADHD is that it can look very different in different children. Mm-hmm. And I think a lot of that has to do with the fact that there are 3 presentations of ADHD. And some parents will say to me, well, is it ADD or is it ADHD? And I'm sure that you get that a lot too. But can you talk about maybe the 3 ways that ADHD can present? Because that can be helpful too for so many parents and teachers.
Well, let's start with the classic one, which to me is the combined subtype. So the 3 types are predominantly inattentive, predominantly hyperactive, and the combined subtype. Combined, I think, is what a lot of folks think of when they think of ADHD. And this is the child who is very fidgety, very motorically active, impulsive, acting out perhaps in class a little bit more than their peers, not paying attention. So the teacher is lecturing or the parents trying to instruct them to do something. They don't seem to be listening or attending to it. Not to say they can't focus. I think in all 3 types of ADHD, you'll see that these children can have tremendous focus when something is interesting for them. So preferred activities really get the dopamine firing, because we understand that ADHD at a core neurotransmitter level is a dopamine deficiency or a dopamine dysregulation condition. And that, little neurochemistry if for those who are listening, but we have the subcortical region of the brain. This is parts of the brain that are not in the surface, but they're deeper in the brain. And there's a region there called the basal ganglia, which projects neurons to the frontal cortex, among to other areas too. And I think the 2 circuits that are most relevant for ADHD are the mesolimbic and the mesocortical. Mesolimbic projects dopamine to the nucleus accumbens, which is kind of in our lower frontal region. And this is the pleasure circuit of the brain. It's the reward circuit. So when you do something good and you feel a thrill, that's what is triggering. But it's also linked to the mesocortical, which is sustained attention, it's working memory, it's multitasking. It's all the things that we classically think of as disrupted in ADHD. And my understanding of what happens in anyone with ADHD is that the rate that dopamine fires, these neurons fire, is dysregulated. That when you are invested in something or focused in something, you have that mesolimbic system firing very well, and the dopamine is full steam ahead. And if you have ADHD and you're doing something that you're interested in, that is perhaps a little bit overactive, that you're getting a lot of reward for doing the thing you're really invested in, but it's at the cost of doing non-preferred activity. Karen, none of us like doing the cleaning out the fridge, right? That's
right.
Definitely
not.
Projects like cleaning out the fridge, picking up all your dog's droppings in the backyard. These are things we do. They're not fun, but we have to do them. But then I think if you have ADHD, the idea is that these things are that much more harder for you. They're that much more incremental. In fact, the metaphor I usually use is that we don't like washing the dishes, but we'll wash the dishes because we have to. But if you have ADHD, the prospect of washing the dishes is as insurmountable as cleaning out the fridge, which is something that most of us really have a hard time doing. At least I do. And my wife reminds me of that all the time. So to speak to what this combined subtype of ADHD is, it's that you have a lot of dysregulation in their ability to inhibit yourself and your ability to sustain your attention. Barclay calls it the disorder of self-control more than the disorder of attention. And there's been times where I've said the word attention in ADHD is a little bit of a misnomer, because there are kids with ADHD who can focus lots of the time. There are kids with ADHD who can certainly hyper-focus with things that fascinate them. But it's more that they have trouble with self-control. They have trouble moving on from one thing to another, set shifting, being in a very non-preferred activity for even a short period of time. I think any child would be very bored in a lecture that doesn't interest them at all. But with ADHD, it's like they can't even do it for even a few minutes. So that's where we start to see some of the behavioral concerns. So really, that's the combined type. And you have to keep in mind it's developmental, in that a 5-year-old with ADHD can present very differently from a 15-year-old or a 30-year-old, because the executive system does continue to mature no matter who you are. And the child who may have really bad executive issues at 7 or 8 may have some of it in 15 or 16, but it's going to present very differently, because some aspects of the executive system are going to have successfully matured. The neurons have demyelinated and they're at a point of relative stability for that, but they're still going to have other difficulties that may manifest later. So back to what we were saying about the subtype. The mind subtype is that these are folks who have trouble sitting still, focusing their attention, and they tend to be motorically active. Then pivoting to the predominantly inattentive type, to me, this is the most qualitatively different of the three, Karen.
I agree.
In that I've even read literature that argues it might even be considered a different disorder, or at least such a different expression of executive difficulties that maybe the way we target it or address it should be considered very different. Because kids who have the predominantly inattentive type, first of all, are not usually behaviorally overactive. They're not motorically speedy or hyperactive, but rather they kind of run on the other end of the spectrum where they're a little bit sluggish in their thoughts. They might seem to be spaced out, daydreamy. They don't seem to be present, but they're not disruptive. So in a classroom, this could sometimes be overlooked if the teacher is busy dealing with the overly, hyperactive ADHD subtype. Might miss the inattentive subtype. So I do find this tends to get diagnosed a little bit later. Usually when you see that the sluggish thinking takes a hit on working memory, so that applied type of learning I was talking about that emerges in 3rd and 4th grade, you might see it there. These are kids who are forgetting to turn in their assignments. There are kids who, don't seem to memorize math facts efficiently, so that maybe they're with a tutor and they're learning math facts on Monday, and then by Tuesday, it's like they're starting from scratch again. On cognitive testing, and I've actually published a little bit on this too, there is some evidence that you see slower processing speed on certain subtests, like the coding subtest of the Wechsler scales. So again, these are the kids who just are a little bit unfocused, and it can impact their learning, and this can have downstream effects on their self-esteem, their of course their learning, of course, because they can fall behind in some of their curriculum, which can result in learning disabilities. So that's the predominantly inattentive. The predominantly hyperactive one, I'm actually curious to speak with your thoughts too, because I don't diagnose this one that much, I'll confess. I have diagnosed it. I mean, there are some kids who do present with this. To me, it just seems like these are children who are probably more on the combined spectrum of ADHD, but their attention just seems a little bit better. Maybe test scores support that they're able to focus even with non-preferred activities. Maybe their CBT is good, although the CBT is terrible. I don't think it's a good test at all for anything, but that could be another conversation. Maybe it's good for certain subcortical disorders that are not ADHD, but that's so I don't give the hyperactive too much, because usually I find that combined sufficiently explains it. But I know different practitioners have different styles, and I certainly can see some practitioners feeling that there are times where ADHD-H is helpful. What are your thoughts on that?
Right. I'm with you. I think when I see ADHD, it's often presenting either as the combined type or the predominantly inattentive type. And I agree with you that they look very different. And I think because they present so differently, that can create some confusion for parents. And I like that you described the preferred versus non-preferred activity and the ability to be able to pay attention, because there's research on that. There's research on kids with ADHD who struggle with non-preferred tasks, and I think that can be confusing, because I've heard parents say, "Well, my child couldn't have ADHD." Even though they're forgetful and they struggle with paying attention to their schoolwork, because they can play Lego without any difficulty for hours, or they can play video games for hours. So it can't be an attention problem. But you describe beautifully, the different pathways in the brain that regulate inattention and focus and working memory, and those that regulate the reward system, which is activated when we're playing and doing things that we enjoy.
And yes, I always think that if parents want to know what ADHD, looks like, in some ways, it's that the executive system, it's not, it's just a little bit delayed. You think of it like a growth chart, right? And often, I think a helpful metaphor is, when you go to the pediatrician, you get these height charts and you get these weight charts, and you show where the child is, compared to their peers. With ADHD, it's that the executive system is a little bit delayed compared to the child's age, compared to the same age peers. A child with 9 who has ADHD might present like a child who's 7 in terms of their executive system. So that's an example. And sometimes you see, not always, but sometimes kids with more severe ADHD, they tend to get along with younger peers because they're kind of meeting them at a certain developmental level. So that's something we sometimes see.
Yes. And I see that as well. And, when you talk about that delay in maturation, and I talk to families about that as well, and then it's almost like an aha. Okay. So now I understand why they're not kind of looking like their same age peers, that they're looking younger in terms of their emotional regulation, which you talked about, that self-control, that attention, the hyperactivity, the fidgetiness that they may have seen, in their younger children who are 5 and 6 years old, and they're looking at an 8, 9-year-old and wondering, why are you still having difficulty sitting still at the dinner table? And I also think that when we think about it as a delay in maturation, that can also lead to a delay in diagnosis, because then teachers or pediatricians or someone will say, well, he'll grow out of it, because my child, like you were saying, had a lot of that when they were 3 and 4. But by the time they were 7 or 8, they no longer had those symptoms. Mm-hmm. And that can be for very different reasons. That could be because there was really just a maturational issue that's developmentally appropriate, like you described earlier. But then for some, that delay in maturation really impacts their ability to function. Mm-hmm. And that's where we really are when we're talking about ADHD. It's not only a delay, it impacts a child's ability to access their curriculum and to really be successful, or to really demonstrate what it is that they know and what they're able to do in a number of settings.
Mm-hmm. No, completely. I agree with you. It's when the executive difficulties intersect with the environment to lead to some sort of functional disability, where this highlights the importance of detecting ADHD and treating it in an appropriate way to help the child thrive. Because, sometimes I get parents who say, like, Dr. Thaler, or Dr. Nick, whatever. They say, like, when, I probably had ADHD and I was fine. Mm-hmm. Well, I mean, without being overly confrontational, my first thought is, were you really fine? I mean, how were you in school? Was it difficult for you? Did you have a hard time? Maybe it wasn't recognized, but were there challenges that emerged? And sometimes, in a conversation, it does pan out that there were some emotional issues that the parent went through. There's often why sometimes there's this resistance to having a child get the diagnosis, is perhaps there's a feeling of your own remembrance of what school was like, and the feeling that this is, a stigma that could lead to some negative consequence, when it's completely the opposite. That, ADHD, I think within the schools, I really have to say there's been a wider acceptance of it as a condition that many children have, and that we have some evidence-based ways of treating it and helping the child thrive. And really, to me, it's about keeping that executive system in check and helping the child so that they can learn, so they can feel good about themselves, so that they can be empowered in school. Because that's where I really see the issues being much more serious, is when a child doesn't understand that they have these difficulties, or the family doesn't, and the child is punished for it, or taught to think that they're quote unquote stupid or slow or delayed. And then the learning disabilities emerge, and then the sense that they're not adequate enough for school, and the self-esteem takes a hit. And this is, I think, much more catastrophic, Karen, than getting a diagnosis of ADHD, which I think is completely fine and appropriate when it's warranted.
Absolutely. Again, and you're talking about the social emotional toll of struggling because of ADHD and having it not be recognized as such. And I've seen it too, where kids internalize the difficulties that they've been experiencing. They're working, and I often tell parents that these kids are working so much harder than their peers just to pay attention, to do something that we all do, or people who don't have ADHD, without much effort. And they're often getting verbal and nonverbal cues that they're not doing what they're supposed to do, whether it be a look from the teacher because they're tapping their pencil, or they've gotten out of their seat again and they're being told, I need you to stay in your seat, or they're dropping things on the floor, or they're having a big emotional response to something very small. And then, and I often tell parents, it's not that the children are deliberately trying to annoy you. And sometimes it can look like that. And then once you have a diagnosis, if that's what it is, it really increases understanding of what it is that parents and teachers have been observing. Wouldn't you say?
Absolutely. I mean, I think that it families understand, the teachers, understand. And when the child is at a developmentally appropriate age, I mean, it can empower the child to know that they have ADHD, that this is not something that's intentional. I've had more than my fair share of kids who, during testing, they'll say things like, come on, like negative self-talk, like they do something impulsive and they kind of know it's impulsive, but they can't help themselves. And they get frustrated or they're confused why this is happening. And, without, I think, an understanding of why, it can be frightening. It can be alienating to feel like you have this side of things where you can't quite control what you're doing.
Yeah. And I agree. It can be empowering because now you understand. And then you also have some hope about that there are things that can be done that would be helpful. There are some strategies and tools that you can learn and adopt that can help. And I'm wondering if you can talk about some of the recommendations. And I know the recommendations will differ depending on the child, because sometimes you have kids with ADHD and anxiety, and that will look different in terms of, your recommendations versus a child with ADHD and dyslexia or a child who just has ADHD. But what are some kind of general recommendations that might be considered? They're not always for all kids with ADHD, but parents will often say, well, if I get a diagnosis, then what?
Right.
What are some things that the research and the literature shows is helpful for kids with ADHD?
I think, starting directly with the family, if there is some sort of dynamic where the parents are overly punitive towards the child, that needs to be addressed immediately, because I think that's where a lot of harm could ultimately be done. Is the parent who's always punishing the child who's acting out because of the ADHD. So, if the parents are open to it, some sort of parent-child interaction therapy, like, might be an appropriate therapy to recommend, or even just, some counseling, and sometimes if the parents are very receptive in a feedback session, you can kind of outline, some of the dynamics that you see that might be causing some of the difficulties. Now, if a child attends a public school setting, there are, of course, avenues in order to obtain accommodations that can be pursued. Probably the most straightforward would be the 504 plan, which would allow the child certain accommodations like extra time on assignments or tests, opportunities to take tests in a distraction-free environment. Teachers, and this applies to independent schools as well, can certainly apply their own techniques. For example, preferential seating, pro-social pairing. So make sure the two kids with ADHD are not working on the group project. Pair them creatively with other kids. Allowing child ample time for breaks. So if they're getting too fidgety, maybe they're the one who delivers a message to the principal, things like that, just to try to get that energy out. And then, of course, in a more formal, if ADHD is particularly problematic or if it's interacting with other disabilities, you can consider an IEP, which is an individualized education plan in the public school system. And this would also provide intervention as well as accommodations. So this could be, access to a resource center, pull out for certain types of lessons, so on and so forth. And in younger kids, sometimes it warrants a behavioral aid who can help monitor a child who's acting out. Certain independent schools also allow aids in some circumstances with younger kids. Now, in terms of pharmaceutical interventions, medication can make a big impact on a child's ability to focus. And it's something that I generally recommend, particularly when I see that this is having an adverse impact on learning or on social emotional development. Then I think we need to address the attentional issues through medicine. I defer specifics to a psychiatrist, of course, but we do know that there's no long-term effects of medication that's negative. And in fact, the longitudinal research, the long-term research on medication and ADHD is the kids who are medicated have better outcomes, probably because they're able to learn more efficiently, and it curtails some of the social difficulties and emotional difficulties that sometimes emerge. I always tell families that you want a good psychiatrist that you can have a conversation with, because it's not like you're going to take one pill and suddenly everything is necessarily better. It takes a process of trial and error, different doses. But once you find the amount that helps, it can really make a difference in your child's ability to take in information. So those are some of the recommendations that I give. I'm sure I've missed a few, but
no, those are some key ones. I think it's not a one size fits all approach to treatment. I mean, it's not just one thing, because some people will come in and think, oh, you're just going to put my child on medication. And just medication alone is not going to address, particularly when we're talking about the executive functioning issues. Oftentimes kids need support and need, again, some skill building in that domain. And the accommodations that you talked about in school are so important because we want to make sure that the children, again, can access their curriculum and they're set up for success. And then, of course, there are things at home. And you talked about the family relationship and how important that is, and making sure that parents are not being overly punitive. And there are also behavioral things that can be done at home to organize the home and to further support the child. So if parents are at home and they're kind of seeing some of the behaviors that you described, maybe the forgetfulness, the inattention, kids who do their homework but leave it at home on the printer or forget it on their bed, it never gets into their backpack, or other behaviors and things that are looked at as symptoms of ADHD. And parents often want to help. It's like, what can I do at home to support my child? Are there things that you find are helpful to the parents that you've worked with?
No, definitely. I would say in a nutshell, you want to make the implicit explicit. In other words, we're adults with busy lives. We're all running around and, assuming we don't have ADHD, although sometimes it's hard to tell, we're trying to multitask and keep several things in our head at once. And sometimes, and I'm guilty with this with my own, I have a 5-year-old, with him, is that you kind of forget that a 5-year-old is a 5-year-old, and a 5-year-old with ADHD is going to have even more difficulty. So you might say like, hey, go, clean up your room. And then you walk by and they're, making a bigger mess. You're like, well, what happened? I just told you to clean up your room. But a child with ADHD or a 5-year-old without ADHD,
right?
Not have taken that in. So when I say make the implicit explicit, it means put out reminders of some kind. If a child's working on the homework, have a timer that shows the clock, that shows like, I want you 15 minutes to work. When that timer hits 0, you can get up and do something else. But you need to listen to the timer because, this is the child, more times than not wants to listen. They want to listen to their parents, younger children, maybe not teenagers. But by giving external reminders, kind of serving as an extra level of executive functioning, it can make a big difference to a child. You can have some rewards. Token charts, I think, are mixed because they're great for a lot of kids. But when you have ADHD, sometimes it's hard to see that much into the future. It's hard to imagine, okay, if I do a week of good behavior, I'll get a toy, because that's a week. What's a week? That could take forever. But maybe short-term rewards could certainly be something that could be promoted. So, like if you spend 15 minutes on your homework today, you can have maybe a half a cookie after dinner or something like that. So trying to come up with some incentives that I think are short-term, but rewarding, good behavior is always helpful. Trying to build up that intrinsic level of reward too, to not make it just always that they have to be rewarded externally. So, there's different ways that can be accomplished that, it depends on the child and what their individual needs and interests are. But I really think it's about behavioral management. And the biggest way to make something behavioral is to make it overt. Behavior is overt. It's something we can all see. So make the implicit explicit in a nutshell.
I think that's great. I think that's really great advice for parents. And it's something practical that they can do. And again, oftentimes they want to be part of the solution. They want to be able to help their child. And I think another thing to keep in mind is that ADHD is a lifelong disorder. And it's not that they will all of a sudden turn a certain age and they will no longer have those symptoms, or you'll treat them with medication and then the symptoms will go away. It'll help with some of the symptoms, but there are things that will continue to need to be addressed in the future.
I agree with that. And I do sometimes say that a lot of adults with ADHD, by the time you're 25 or 26, which coincides with the time that your brain is fully matured, after this, it's all downhill from there. A lot of people with ADHD can manage their symptoms on their own. I think the literature supports that, but I think it's important that parents keep in mind it is a lifelong condition, but it's not one that's always going to necessarily be disabling. That it's not like they're always going to have to take stimulants necessarily. That adults live with ADHD, and many are extremely successful because of their ADHD, not in spite of it. Because of their ADHD, they find their passion, they find what rewards them, and they go on and accomplish great things.
Absolutely. And I think that's a really great reminder for parents as well, is that the struggle that they see now will not always be the struggle for their child. And I also see a lot of kids in adolescents and young adults who no longer meet criteria for ADHD as older adolescents and young adults. And like you said, they've managed the behavior. They've got the early intervention. Their brains have been, rewired as a result of being able to pay attention because they had maybe some medication management early on that they no longer need. And so there are a lot of things that can play a role in supporting children who have ADHD symptoms. And I think understanding what ADHD is, understanding that there are things that we can do to help address the things that we're seeing. And it makes such a big difference for the kids who are experiencing the struggles related to ADHD in the long run.
Yeah, to me, ADHD itself is not a big deal. It's that there are the risk factors that come with ADHD for certain kids in certain situations where that's what we have to curtail, because that's where the difficulties really emerge. And it does depend on the child. It depends on the school. It depends on the family dynamic. I mean, there's a million and one things that can affect it. But having this, the dysexecutive system of ADHD just makes it harder to adapt to some of these situations.
Mm-hmm. And, I think that this is a really great kind of first discussion about ADHD. And you just did a beautiful job of kind of introducing the topic to our listeners. And we're going to continue the conversation because, again, there's so much to discuss with respect to ADHD. And we're going to put a link to the show notes to where people can get more information about executive functioning, because, you spoke a lot about it being kind of a dysexecutive syndrome, and it's been described as that. There's been a lot of confusion about that self-regulation piece of ADHD, because, again, when you think of ADHD, you think of inattention, hyperactivity, and impulsivity. You don't think tantrums, which are part of a self-regulation issue. And so I just thank you. I'm very thankful to you for sharing information about ADHD and really describing the different ways it can look in different kids, because I think some parents and some teachers will get an aha moment and say, okay, so maybe it is something that I should be concerned about, and I should follow up with my pediatrician maybe first, check in with the teachers, and maybe even inquire about an evaluation for my child to determine if there are other things that we can do.
Mm-hmm. Well, thank you, Karen, and I'm delighted to have been invited on. Thank you for the opportunity.
Wonderful. And I know that people are probably going to want to get in touch with you and ask more questions. What is the best way for them to reach you?
I'll give my email. It's my first name, Nick, N-I-C-K. There's a dot, and then my last name, Thaler, T-H-A-L-E-R. So it's nick.thaler@gmail.com, and that's my email.
Perfect. And I will put all that information in the show notes and any other information that you want to share about ways to connect with you. So thank you so much. This has been incredibly helpful and informative, and I appreciate you being here.
Thank you, Karen. Thank you for having me.
There was a lot of great information in this episode, and we will be exploring this topic more in the coming weeks. So make sure you subscribe to the podcast. I want to take this opportunity to thank those of you who have left a review. Allie Loves Bigfoot wrote, Dr. Karen is an incredible resource for parents and their children who are facing challenges with emotional health and well-being, particularly during COVID stress times. As a parent with a kiddo who has been struggling with wellness, listening to Dr. Karen's insights and practical advice has been helpful and supportive. Thank you for all that you do. Dolecat wrote, if you are a parent and looking to be educated about your child's mental health, this is the podcast. I've been listening to this podcast since its launch. I was so lucky to find it. The topics covered here, I can't seem to find anywhere else. I enjoy hearing Dr. Karen's thought leadership and expert advice, and the experts she brings in from Child Nexus are a great bonus. Thank you, Dolecat, and thank you for listening.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.